So we are about to get started. We've got a really exciting conversation about COVID-19 booster shots. Just gonna invite my. We'll get started in a moment. Hey, Rama.
Hi, Jewel.
I'm good. How are you? Well, I said how are you, Rama?
I was definitely gonna ask you next, how are you? But all I said was hi, Jewel. But
Yeah.
how are you, Jewel?
My bad for jumping the gun. I'm good. I'm good. In office today, down the hall from you, so that's exciting.
Yes, we get to see each other in person today.
Yes.
That's
Excited. Um, well, yeah, today, everyone, we're gathered here to have a quick conversation about COVID-19 booster shots and kind of what to expect and what that rollout plan is looking like.
right.
Hopefully, to help answer any questions or alleviate any concerns about getting a booster shot if you are feeling a bit hesitant.
Yes, yes, all of that, and then some.
Um, but to,
So, go ahead.
well, to start off, my name is Jewel. I work in the External Affairs Department at Whitman-Walker Health as Director of Communications, and my pronouns are she, her, hers.
And my name is Rama, and I'm in the Community Health Department, and my pronouns are she, her, hers. So yeah, so you all have noticed since the pandemic, we've developed a robust social media outreach platform and really increased Whitman-Walker's presence online to continue giving these public health, general public health information and interventions, and discussing HIV and STI sexual health practices, access to care, and really addressing social determinants of health as well, while focusing on the current pandemic. As you know, like all of our lives we're going, but COVID-19 is a huge part of our everyday lives, you know. And as healthcare providers, it's really important to ensure that every conversation is interwoven into COVID-19. So that's what we have been doing here for you on these platforms. And as Jewel mentioned, today we're going to discuss more about the COVID boosters, and discuss a little bit our experiences, our personal opinions, you know, alongside our professional opinions about the COVID-19 booster shots that are now available to some folks. So yeah, and of course, we'll get more into where you can get vaccinated, how you can access these services, and you can, first and foremost, the number right there, Whitman-Walker Health, you know, you can get all those things here with us, but just a simple phone call or an email to us, and we'll support you.
For you.
Yes, we are here for you. So yeah, so Jewel, can you tell us a little bit about like what is a booster shot and like get into a little bit about COVID-19 booster shots?
Yeah, definitely. So booster shots and vaccines are given to enhance protection levels against a virus after initial dose or doses of that vaccine have been given. So, for example, you know, for years and years, you may have heard of people talking about getting their tetanus booster shot. These are things that have been done for years. Booster shots aren't new, so the concept of booster shots didn't just start during the COVID-19 pandemic. And in fact, um, it's just another one of those tools that we have in our back pockets to help fight this pandemic, to help kind of strengthen up our protection against these new viruses as they come out and kind of variate over time.
Say it again. Like, say it again. The concept of booster shots is that new.
That part.
Like, it's just that's the first thing that we want everyone to keep in mind. It's not new. It's not because it's COVID-19 vaccine. Boosters have been here, and so yeah. Sorry, Joel. Go ahead. Back to you.
Important introduction. Yeah, with this pandemic and it's going on for, you know, what is it, 19, 20 months at this point. Everything will feel as if we've never heard it before, right? As we continue to get new updates and whatnot. So they sound new because it's part of the COVID-19 pandemic story, but booster shots are not new. They were here before COVID-19 and they will be here after COVID-19. Or I guess during the prolonged COVID-19. But yeah, so currently the COVID-19 vaccines that are available offer very strong protection against severe illness, hospitalization, and death. But vaccinated people who are severely or moderately immunocompromised are still very vulnerable to COVID-19. And that's mostly because they are more at risk for getting really sick or having serious and prolonged illness from COVID-19, and because they may not be able to build that same level of protection of immunity to a 2-dose vaccine series compared to people who are not immunocompromised. So it's like the same 2-dose vaccine that helps keep one person really healthy and protected from COVID-19 may not be as effective as it does for someone who does have like a pre-existing condition that affects their immune system. Additionally, because that extra level of vulnerability, the CDC is recommending that people who are moderately to severely immunocompromised receive an additional dose of an mRNA COVID-19 vaccine after their initial 2 doses. So when the CDC says mRNA COVID-19 vaccines, it's really just referring to the vaccines created by Pfizer BioNTech and Moderna. Currently, the Johnson & Johnson vaccine uses what's called a disabled adenovirus instead of mRNA technology. And so research is continuing to go on to figure out whether people who receive the Johnson & Johnson vaccines are going to require booster shots in the future.
Right. So boosters right now, Moderna and Pfizer. You know, we're not there yet. We're still developing when it comes to J&J. And when we discuss, like when we talk about folks who are immunocompromised and moderately to severely immunocompromised, some examples that you can think of are people living with comorbidities to begin with, but some specific things have come out from some of the CDC guidance, like if you've been receiving active treatment for tumors or cancers of the blood, you're definitely a candidate that should be looking into or talking to providers about getting this booster shot, received organ transplants or taking immunocompromised medications, it's like immunosuppressants. So making sure, because we need that immune system to be strong, fall and winter, it's around the corner. And, you know, stem cell transplants, if you receive that, and again, the medication and anything, just severely to moderately immunocompromised, it is time. It's been the 8 months. It is time for you to get that booster shot, you know, to enhance that protection against the virus. And of course, if you're if you have advanced or untreated HIV infection, or you know, whether you're newly diagnosed or living with HIV, depending on the other comorbidities, you know, it's time to have that conversation with your provider, especially if you are in care with Whitman-Walker, have that conversation with a provider or anywhere, or even if you're not at care here, you can definitely still call us, and then we'll support you and kind of guide you through the next steps if you're interested in just learning more about the boosters and your options and if you qualify. And the most important thing, again, as I've been mentioning and we've all reiterated here, to make sure that you talk to your provider, you know, about your medical condition, assess it, if you need additional dose, when you got your vaccine, if you still need to be fully vaccinated. Again, those are just some of the qualifiers and eligibility for folks. And the timing, as we mentioned, within that, after 28 now, it's like within 8 months, people who have been vaccinated, it's been about 8 months since you've received your first dose. It's time, and if you're immunocompromised. But however, if your providers can now, if you're just now getting the vaccine, you've gotten all your research done, you're just started, you got your vaccine like 28 days, you've been fully vaccinated, you have 28 days after being fully vaccinated, you are eligible to get your booster shots. So from Moderna and Pfizer. So just keep that in mind. You don't have to wait like 8 months after or anything like that, especially if you are immunocompromised. And different recommendations are coming out too about that. And feel free to ask questions in the chat too. We're here to answer them.
We are, yes, we are. Thank you for that information, Rama. It's so important to know when people should start to seek out these booster shots once they are more available to folks. So just a few other notes about this rollout. The CDC notes that the current protection afforded by the COVID-19 vaccine against severe disease, hospitalization, and death could really diminish in the months ahead, as Rama just stated, especially amongst those who are at higher risk and were vaccinated earlier on during the early phases of vaccination rollout. So this is your December people, your January people, your February folks, all of the like frontline workers, people who are in uh, healthcare home facilities, especially our elder populations. So this is really who it's time for these 8-month vaccination booster shots are for. So again, for this reason, because of the time, a plan is in the works to offer booster shots to maximize vaccine-induced protection and prolong its durability for offering protection against severe hospitalization, death, and disease from COVID-19. That said, if the plan receives approval from the FDA, which we're hoping to hear this Friday, individuals who are fully vaccinated earliest in the vaccination rollout will be offered a COVID-19 vaccine booster shot 8 months after their second dose, starting the week of September 20th. So that's next week, everybody. Hang on tight. This plan is so there's lots of moving information, so just stay tuned. Get your CDC alerts on, get your FDA alerts on, get your news source alerts on, not Instagram notifications on. Important part.
Credible sources.
Boom, credible sources. And then in the meantime, if you still need to get your first dose of the COVID-19 vaccine, we definitely encourage you to reach out to vaccinate.dc.gov or visit vaccinate.dc.gov if you're a Washington, D.C. resident. If you live in Maryland, you can visit covidlink.maryland.gov. And if you live in Virginia, you can visit vaccinate.virginia.gov.
So now that we kind of gave you a little bit of background what boosters are, what's approved, what are we looking forward to, where you can get vaccinated. Joel, like, where are you with the COVID-19 boosters? Like, how are you feeling? Like, what are the vibes for you?
I think I'm in a place where I'm waiting to see what happens, hopefully this Friday or this week with the FDA and then kind of their plan and their approvals. I'm definitely in that sweet spot of it almost being time for me to get a booster shot. But other than that, feeling okay. I'm not a person who's immunocompromised, so we'll see what they say about folks who aren't in that bucket and have, some protection already. But kind of just patiently waiting to see what happens and prepared to do my public health duty of getting my booster shot vaccine if I need to, if recommended to by the CDC and FDA. How about you? Where are you with getting a booster shot?
As we talked about, like, it's already approved. Folks who are immunocompromised, FDA has already approved it for you to move forward with getting, whether it's a Pfizer or Moderna shot, with the conversation after having a conversation with your provider and just kind of deciding what's best for you. So with that, for me, I am, living with sickle cell. So, and September is Sickle Cell Awareness Month. Shouts out to all my sickle cell warriors. So definitely as soon as the conversation started, again, I've been having conversations about the booster shot with my providers and my hematologists and my primary care physicians and just even my dermatologists. Okay. So and everyone is in cahoots that I should get it. So I think I actually already got my booster shot August 19th. So as soon as the speculations or some conversation, the White House started talking, boom, I was like, okay, guys, this is approved for us. So let's go ahead and get me that booster shot. With the Delta variant being the dominant variant, the dominant strain, and I know we've all heard of all the sororities and the fraternities. Like, we have the Lambda variant, we have the Mu variant. Not another variant, and ideally we would want everyone to at least get their first and second dose. Like, that is ideal. But for those of us who are vaccinated, we really want, need the protection. So I was really excited to have the opportunity and privilege to be able to take that, my booster shot, because it was I was going back into hibernation again, although I was fully vaccinated, but I was back in December is when I got vaccinated. So I'm definitely towing that 9-10 month line. So so about the side effects were similar to, unlike my first and second dose of Moderna, where I didn't experience as much side effects or anything like that. I think this time around I was between the COVID fatigue, and I was in the midst of a sickle cell crisis when I took my booster, and as my body was adjusting to the booster, it definitely caused some soreness. Nothing nothing too insane. Again, I was nursing a sickle cell crisis already. So definitely not taking my immunosuppressants prior to the vaccine probably is why I felt it a little bit more than the first time. But afterwards, after I got back on my regimen and things like that, it was fine. It was like less than 24 hours even, but definitely injection site, a little soreness and things like that. So again, and that's where most of my crises and pain was concentrated for sickle cell at that time, so it didn't help. But the benefits outweigh all of that, because I was able to just, okay, I can go back outside, I can talk to people, I can be around my vaccinated folks, and things like that, and feel safer and feel better. So the benefits definitely outweigh the 24-hour side effects of the booster shot. So I just feel privileged to have the access to the vaccine and to be able to get it to protect myself and my community, and I really, I just encourage everyone just to learn more about it, do learn more about it. Like, understand that this is for you, it's for you. It's for us. This is not, COVID-19 is not a virus that we can combat individually. It's definitely a community effort. And folks like myself, folks like Joel, anyone, we're relying on one another to protect each other. And it's hard. It's really hard with everything that's going on. But definitely take the time to understand why the vaccine is beneficial to you and your community.
Thank you, Rama. Thank you for that beautiful share. I think it's so important for folks to be able to hear from someone who identifies as immunocompromised and who's gotten this booster shot so early on already. Like, thank you for stepping up to the plate and really putting your community on your back. And I appreciate, I won't speak for everyone who's listening in, but I appreciate you doing that and sharing that with us in this space here.
Thank you.
And good to hear about the side effects. I mean, when I first got my first dose of the vaccines, I didn't really experience any crazy side effects. So hopefully that continues for my third shot if I ever get one. We'll see what happens Friday. But that's super valuable information too. Like, I think a lot of folks are afraid of what will happen when they get their shots and if they're going to experience side effects. And the truth is that there's a good amount of people who don't experience any side effects. So yeah, if you've got
definitely, even folks like you mentioned, like both of us, when we were fully vaccinated, I think we were like, what did you, your side effects? Oh, kept it moving. Nothing happened. I even asked, did it work?
I was like, did they give me the right shot? Are they sure? Because from reading, it feels like I got the wrong one. But yeah, folks, if you have questions, concerns, hesitations about getting vaccinated, please definitely look at our pinned comment. Call us at 202-207-2480. Our team members are there to answer and respond to your questions in English and Spanish. And beyond that, we can also support anyone who calls in with our language access line. But please give us a call. We're happy to talk through any of your concerns, any of your questions, any of your hesitations, all the things. Be a sounding board. We are here for you. But I think, in wrapping up, I just wanted to say that, my reason for getting vaccinated was that I wanted to protect myself and my community. And I knew that I'd be in this position to be, asking folks to get their vaccines and providing resources for how they should get their vaccines. And I didn't feel like I could do that work honestly and authentically without being vaccinated myself. So yeah, got it. I felt more at ease navigating life during our ongoing COVID-19 pandemic and continuing to feel more at ease about navigating life during this continuously ongoing COVID-19 pandemic.
Right. I think from the beginning of the pandemic, just realizing that it is a community effort and a community response, I think I gave myself until 2022 for some semblance of normalcy, in the sense of no masks, so we're moving around. Not that I don't think I will ever not wear a mask again in public spaces. It doesn't matter what happens. But I think wearing a mask is just a part of my life now. And I really do love that for me. No colds, nothing. I feel better. But as far as it relates to like COVID-19 being at the forefront of like the health crisis and things like that. I thought by 2022, it would be mitigated a little more, just be like another, like another thing, like another condition, another virus that we've gotten, like, getting a cold, a common cold, things like that. Although the vaccine does allow it to feel that way for folks, but just generally, considering where we are, of how many folks are not vaccinated, how many folks are declining the vaccine, how many folks don't feel that they don't have access or access to enough information, as looks like 2022 might be another year. So, but the only way to be at ease is really learning more about the vaccine and understanding that people are still getting COVID. People are still dying from COVID, and those are our Black and Brown communities. So it's important to educate yourself to really make the decision, but like learn an informed decision, not based off of the misinformation that's on social media, the misinformation that's within the group chats. Like, it's simple to do a simple research and go to credible sources, and you can definitely chat with us. And I personally feel extremely privileged to have had access to not only be fully vaccinated as a healthcare and a frontline worker, but as someone who's immunocompromised, to have access to the booster so early, and really it allowing me to live in a way that that's okay, but I still hurt for my community. I still hurt for my people that, and I'm just wondering like how to remove that barrier for my community to learn more and really trust the science. The healthcare system, I totally get it, but the science behind the vaccine, like, I am living proof that it works and that it's necessary. And, again, just remember, it's a privilege that we have access to. We can walk outside to get the vaccine. So many folks who want the vaccine in developing countries don't have the access to it. So I really exercise my privilege to be vaccinated and to be healthy and protect my community and learn more. And with that said, if you are in DC, Joel mentioned this earlier, and you want to get vaccinated, coronavirus.dc.gov. If you're in Virginia, vaccinate.virginia.gov. And if you're in Maryland, covidlink.maryland.gov. And just make sure that, please don't forget, you need to wear your mask. Okay, masks are still very important. If you're unvaccinated, whether you're unvaccinated or not, wearing masks in closed spaces, close encounters with folks, it's very, very important to protect yourself and others around you. And getting tested, we have walk-up testing sites. You can get tested here at Whitman-Walker. You can access the vaccine at Whitman-Walker, and that number is right there with just simple information. So yeah, just make sure you're taking care of yourselves and you're following the CDC guidelines, and remember that this is a community effort. It's not at the individual level. So it's all of us.
All of us in it together. And just if you are a person who's unvaccinated and you still are waiting, you're wanting to wait and see what happens still, even though it's been about 9-10 months since the first vaccines were administered. It's just super important that you listen to what Rama just said, that you're, practicing physical distancing of yourself of at least 6 feet, that you're avoiding indoor spaces, that you're avoiding indoor spaces, that you're not trying to resume life as musical. Oh my gosh, you guys, words are hard now. That you're not trying to resume life as normal. You've got to keep your mask on over your nose and mouth. And, while you're waiting and seeing, please, again, you can call us at 202-207-2480, and we're happy to walk you through any questions or concerns, vaccine infertilities, vaccine and side effects, vaccines and what about my herbs, all of it. We're happy to talk through what, the factual information is, what the myths are, and how you can protect yourself.
Yes. Thanks, Essie. So yeah, thank you all for joining us. And this live will be saved so you can catch it and watch it again.
Yes, watch it shortly on our Instagram, and please feel free to keep up with us here on Instagram. We do weekly lives. You can follow us at Whitman-Walker, at Real Talk DC _, at No Filter DC, and at The Corner DC. And if you're looking for ways to support Whitman-Walker, you can register to walk, run, and donate to our 35th anniversary of the Walk and 5K to End HIV. It's formerly known as AIDS Walk Washington. We had the first one back in 1987, so this year is our 35th anniversary. And this year's walk will be on Saturday, October 23rd. It's a little bit different this year. We won't be at Freedom Plaza, but you will be able to walk or run a route of 5K distance here in the city or wherever you live. But yes, you can do all of that, register, walk, and donate at walktoendhiv.org. Cool. Well, wishing you all a great rest of your day.
Thanks, everyone. Bye.
Goodbye.